day. These heroes treat patients who are sick with the virus and confront the families of those who have lost loved ones. They respond to emergency calls and keep our communities safe. They stock our grocery and drugstore shelves. They keep our transit systems running. And they clean our hospitals and offices to prevent the virus from spreading further. Tens of thousands of essential workers have been infected with the virus, and many have lost their lives. I am particularly concerned that many essential workers still lack basic protections that are needed to keep them and their families safe and healthy. That must change. It is unacceptable for 4 months into this public health crisis that many frontline medical professionals and other essential workers still face shortages of critical supplies like masks and hospital gowns. These shortages must be acknowledged and immediate steps must be taken to procure and distribute these necessary supplies. At last week's briefing, this subcommittee heard from 2 former FDA directors and other bipartisan public health experts who warned that safely reopening our economy requires a comprehensive nationwide strategy for testing, tracing, isolation, and treatment. Protections for essential workers must be a cornerstone of that strategy. Otherwise, these workers will be put at an even greater risk as states begin to reopen and we all face a greater risk of a second wave. Essential workers across the United States have incalculable sacrifices to serve their communities during these dark times. We owe them our thanks and much more. We must provide them the protections they need, the financial support and paid leave they deserve, and the clear public health guidance that is critical to prevent further harm. Today, we will hear the stories of some of these workers. We will hear from Leilani Jordan, a 27-year-old Largo, Marylander who continued to work at a grocery store during the pandemic in order to serve her neighbors and community. She passed away due to the coronavirus. We are honored to be joined today by Ms. Jordan's mother, Zenobia Shepherd. We'll also hear the story of Jason Hargrove, a bus driver from Detroit who died from the coronavirus. And we are honored to have Mr. Hargrove's friend and fellow bus driver, Eric Coates, with us today. The committee will hear today about the stress and anguish faced by essential workers who fear spreading the virus to loved ones and have been forced to isolate themselves from their children and their families. We will also hear about the financial stress that forced many low-income Americans to keep showing up to work despite the risk. And we will hear from first responders who battled the pandemic at the peak of the crisis in some of the hardest hit areas of the country, including New York City. These cities and states have been literally begging the federal government for months to provide more resources to protect these workers, and many are still waiting. Today's witnesses have agreed to share their stories with us, including the incredible, painful loss of their family members and friends. I hope we can honor their loved ones and ease their suffering by conducting today's proceedings in a truly bipartisan manner. I hope we can find out about their needs and how we can fulfill them. I will now yield to the distinguished ranking member, Mr. Scalise, for opening remarks.
Thank you, Mr. Chairman. And I join all the members of our subcommittee in thanking our witnesses. We thank not just our witnesses that are here today with us, but all of those frontline heroes, our nurses, our doctors, EMTs, the grocery store workers, truck drivers, janitors, factory workers in those essential industries. Mr. Chairman, there are millions of Americans all across this country who have responded to this call. We mourn everyone who has died from this evil virus, and I share with you in welcoming those members that have loved ones and friends that have been some of the tragic victims of this virus. Too many families have been unable to say goodbye. Too many Americans have lost their jobs or their businesses. Too many Americans and students had their education interrupted. But because of people all across the country, like the witnesses that we have today, the virus has met its match. It will be defeated. Americans do not hide from a fight, Mr. Chairman. We don't back down. We will confront this challenge like we've confronted so many others in our nation's history. The Select Subcommittee must honor those heroes by focusing on helping families get back on their feet, by helping businesses safely reopen, and by holding China and the World Health Organization accountable. China moved in January to contain the outbreak domestically, yet they allowed the virus to spread to America and other nations all around the globe. Mr. Chairman, yesterday the Republicans on the subcommittee sent a letter urging you to immediately call on World Health Organization Director General Tedros and Chinese ambassador to the United States, Sui Tiankai, to testify. We requested to hold the hearing in person, of course, at the Capitol, but we're doing this by WebEx. We do know this, Mr. Chairman. China lied to the world about this disease. During critical periods in December and in January, China withheld evidence of the virus, evidence that confirmed that there was human-to-human transmission of this virus, evidence of the extent of the spread. China refused entry of American and other medical experts from around the world for weeks. Our medical experts wanted to go in. Their medical experts wanted us to go in, but it was the Chinese Communist Party who said no because they wanted to hide what was happening from the world. And during this time, Mr. Chairman, China hoarded key medical supplies, those very PPE that we've been so fervently trying to get manufactured in America, because China manufactured most of that, and they hoarded those supplies, the masks, the gowns, the other life-saving PPE. They hoarded it for themselves, and they imported it from other countries while they were hiding from the world what was really going on. This is something that the Chinese Communist Party directed. We need to look into this, Mr. Chairman. China knew the danger posed by the virus, and while they hid the truth, they used that time to stock up on not just PPE, but other vital medical supplies that they still hoard to this day. While Chinese authorities limited domestic flights from Wuhan to other Chinese cities like Beijing and Shanghai, the China government urged international carriers to maintain their flight schedules, seeding the virus throughout the rest of the world while they knew what was going on in their country. The WHO received warnings of human-to-human transmission of COVID-19 from the Taiwanese government in late December of 2019, but they failed to act on that information. For more than 2 weeks in January, the WHO made a series of public proclamations that human-to-human transmission was not occurring, despite mounting evidence all across the world to the contrary. In late January, the head of the WHO praised Chinese President Xi Jinping for, quote, the seriousness with which China is taking this outbreak, especially the commitment from top leadership and the transparency they have demonstrated. Of course, Mr. Chairman, we know this all turned out not to be true. At the time of that announcement, the WHO's international experts had not even been granted access to China. Mr. Chairman, America has embarked upon an unprecedented response to this challenge for the past few months. We're testing over 300,000 people a day, and that number keeps growing. The Trump administration has has procured hundreds of millions of PPE supplies from all across the globe to provide for our healthcare workers on the front lines combating this crisis. We all work to continue to increase that number, and especially to bring that manufacturing back to the United States so we don't rely on countries like China who are hoarding this. There are all kinds of numbers on the increases in numbers of things like respirators, masks, face shields, gowns, and gloves, and we provided that to committee. America's paid too high a price for China's lies. This subcommittee owes it to all of our frontline heroes to expose the truth and to hold China accountable. I urge the chairman to schedule a hearing on this scandal as soon as possible. And with that, Mr. Chairman, I will yield back.
Thank you very much, Mr. Ranking Member. Now, I would like to introduce the essential workers and their family members who are with us today. Dr. Megan Ranney is an emergency physician and associate professor at Brown University in Rhode Island. She has treated patients with coronavirus and helped start an organization to assist healthcare providers in need of personal protective equipment. Delicia Harden is a registered nurse at the University of Chicago Medical Center and chief nurse representative of National Nurses United. Delicia works in a unit that treats patients suspected of having coronavirus. Eric Coates is a bus driver with the Detroit Department of Transportation, who I mentioned earlier. Diana Wilson is an emergency medical technician with New York Fire Department. Ms. Wilson has responded to emergency calls for those experiencing severe coronavirus symptoms. Marcos Iranda is a custodian at Pacific Gas and Electric in San Francisco, where he cleans and sanitizes offices. Dr. Shanti Akers is a pulmonary and critical care physician at Phoebe Physicians in Albany, Georgia, an area hit hard by the coronavirus outbreak. Steve Pettis is managing partner of the Dickey, Brennan and Company Restaurant Group in New Orleans, Louisiana. Zenobia Shepherd is a decorated Navy veteran and mother of Leilani Jordan, who I also spoke of earlier. Thank you all for being here today to share your stories. With that, I will recognize Dr. Ranney for her opening remarks. Dr. Ranney.
Thank you, Chairman Clyburn and Ranking Member Scalise and the rest of the members of the committee for the opportunity to talk about these issues today. And I'd also like to start by thanking the other panelists for also being out there doing our jobs during this crazy pandemic. So I'm an emergency physician, as Chairman Clyburn mentioned, and a public health researcher at Brown University. And today I'm going to share my perspective from 3 vantage points. First, the shortage of personal protective equipment. Second, the physical and mental effects on ER docs and other frontline healthcare workers. And third, from our perspective, what comes next. As you've already heard, a little over 2 months ago, the life of every healthcare worker across the country changed for the worse. My own hospital system had been preparing for the pandemic since the novel coronavirus was first reported. We'd done our best to build up stores of masks and gowns, but by mid-March, as the number of sick patients coming through our doors started to skyrocket, our PPE burn rate, the number of masks and gowns and gloves that we used each day, had gone through the roof and has been described, the supply chain had completely dried up. Hospitals, counties, and states across the country were running out of essential protective gear, and there was no more to be had. Overseas manufacturing had been diverted to other hotspots like Italy. Our national stockpile was inadequate and quickly depleted. We internally had not ramped up our U.S. production in time. We were told by the U.S. Centers of Disease Control to use bandanas when we ran out of masks. And to be clear, bandanas have no utility in the healthcare setting. Without this essential and adequate PPE, frontline workers, like all of us who are joining today, were unable to protect ourselves from being infected. As a result, over the last 2 months, I have innumerable colleagues across the country who have been infected by COVID-19. Many have been hospitalized and some have died. Now, in emergency medicine, we are used to doing without. Every single day, emergency departments across this country have our finger in the dike of the broken American healthcare system. But nothing had prepared us for COVID-19. Almost overnight, our EDs were full of really sick patients for whom we had few treatments. Our patients were alone. No visitors were allowed. We healthcare workers were scared, both of getting sick ourselves and scared of failing our patients. Because of the shortages of PPE, we couldn't sit at their bedsides and hold their hands. And because of lack of scientific knowledge and lack of supplies, we often couldn't save them. We began running out of not just PPE, but also other essential supplies. Basic medicines, like the ones we use to sedate a patient who's on a ventilator. Basic supplies, like the plastic spacers that we use to administer albuterol, a treatment for asthma or wheezing. We were operating with levels of supplies and facing ethical dilemmas about who to give treatment to that we would never normally tolerate in the United States. As a result, many of us on the front lines felt abandoned, like we were on our own. And the secondary trauma from this experience is only just beginning to be felt. Personally, I'm frustrated and exhausted. On behalf of my colleagues, we are seeing higher levels of burnout, anxiety, sleeplessness, depression, PTSD, and much worse. One of my colleagues, Dr. Lorna Breen, a fellow emergency physician, died of suicide less than a month ago, faced with COVID-19 herself and trying to run an emergency department that couldn't take care of the numbers of patients coming through the doors. That said, I'm also here to talk about hope and solutions. As has been mentioned, in the early days of the pandemic, I and other healthcare workers began to speak out on Twitter and other media outlets about the shortages of PPE, the lack of testing, and lack of supplies. Very quickly seeing that there was no one coming to save us, we decided to band together and create an organization, Get Us PPE, whose original goal was to match donated protective equipment from non-medical settings to healthcare workers across the country. We wanted to distribute PPE equitably, so it didn't just go to the big name hospitals, but it went to everyone, whether in a hospital, a nursing home, other frontline healthcare workers who were in desperate need. Within a week, we received requests for PPE from over 1,000 facilities. Within a month, we'd received more than 7,000 requests from every state in our union, as well as Puerto Rico. And in collaboration with regional and corporate partners over the first month of existence, with med students in Chicago, Boston Scientific, our tribal nations, even Amazon, we delivered well over 1.6 million pieces of protective equipment to healthcare facilities across the country. But this is not enough. We've had thousands of new requests for protective equipment in the last 2 weeks. Early on, everyone needed surgical masks. Now we're seeing needs for gowns, PDI wipes, and other essential needs. One thing is clear, the PPE shortage continues in America, and as long as this virus is here, we need a more stable and predictable solution than what we are able to provide as volunteers and donors. Over the past 2 months, I have seen the best, but also the worst of our country. I have hope based on the ingenuity and kindness of Americans across this great nation. But we need your help from the federal government. The HEROES Act is a beginning, but we must adequately ramp up domestic manufacturing, increase the stockpile available for distribution to frontline workers, enhance our data on protective equipment and other medical supply needs, and ensure that this protective equipment is distributed equitably to everyone who needs it, not just the doctors and nurses, but all of the other workers who are going to be speaking on this panel today. With that, I will close. I thank you so much for your time, for your dedication to keeping us all healthy and safe, and to creating a robust public health response that will protect our communities. Thank you.
Thank you, Dr. Roney. And now we'll hear from Ms. Harden.
Good morning, and thank you, Chairman Claiborne, Ranking Member Scalise, and members of the committee for giving me the opportunity to share my experiences with you today. My name is Talisa Hardin. I'm a registered nurse at the University of Chicago Medical Center, and I'm a proud member of National Nurses United, the largest union for registered nurses in the United States. I work in the burn ICU, and since the pandemic began, our unit has been operating as a PUI unit, persons under investigation for COVID-19. Patients come to our unit when they are being tested for coronavirus. When they test positive, they are sent to the COVID unit. Our unit is a revolving door for COVID-19. The percentage of patients who eventually test positive is very high, but our hospital management has consistently refused to give nurses in my unit the protections that we need to avoid exposure and infection. Before the pandemic, nurses could access PPE from a supply room. When the pandemic hit, management took all of the supplies out of the room and they haven't been restocked. For the first 2 months of this pandemic, nurses in the PUI units did not have access to N95 respirators that would protect us from COVID-19 exposure. Or we were forced to reuse N95s for multiple days. N95s are intended for single use only, and the reuse of these masks puts nurses at greater risk of exposure. In March, the CDC weakened their guidance on healthcare worker protections, and management used the CDC's new guidance as justification for their failure to protect us. As the chief nurse rep for the union, I took part in discussions with management about these issues. It was deeply disappointing to listen to hospital attorneys, people who have zero experience with medical or nursing care, refuse to listen to healthcare professionals in their hospital. Management was consistently condescending and patronizing to our nurses. They told us that the hospital wouldn't give out N95s because they didn't want to run out before the end of the pandemic. They did not have a shortage at the time. Would you rather run out of N95s or nurses? More than 2 months later, our hospital is still failing to protect us correctly. We still need to constantly don and doff our N95s, which increases our risk of exposure. We aren't given hospital-issue scrubs. We aren't notified of exposure when a patient or coworker has tested positive. And we aren't tested for COVID-19 unless we are symptomatic. As a result, we are at greater risk of exposing our families and our patients to coronavirus. Excuse me. Ongoing low staffing levels has made the situation even more challenging. We did not have enough nurses in the ICU before the pandemic hit, and we certainly did not have enough now. To compensate, hospital management has instructed other nurses to work in the ICU after receiving only a 2-day orientation. Normally, a nurse would receive 12 weeks of training before working in the ICU. This inadequate staffing plan has increased the stress on ICU staff and put patients in danger. Nurses in the PUI unit feel especially vulnerable in our hospital. Nurses in the ER and in COVID unit have higher level of protection than we do, even though a high percentage of COVID patients come to our unit. As a result, nurses in the PUI unit account for 90% of all nurses who have tested positive for COVID-19 in my hospital. The nurses in my unit have been terrified of bringing the coronavirus home to our families. I cannot adequately put into words the stress that this fear has caused us. For me, the lack of protections in my unit have forced me to send my daughter away to live with my mother for her protection. It has been more than 5 weeks since I last saw my daughter in person, and I don't know when I'll see her again. She is so frustrated by the situation that she consistently asks me to come home and has recently asked me to quit my job. She is worried, she is scared, and she is experiencing separation anxiety. I live in fear of contracting the virus. I leave my scrubs outside in a plastic bag for days before I bring them in to wash them. Like many other nurses, I have been experiencing terrible headaches, facial pain, and skin rashes due to wearing masks for 12-hour shifts. The situation that nurses are forced to be in is astounding. Our hospitals have consistently failed to give us the protections we need. It's clear to me that our country has not established the systems necessary to protect frontline workers during a pandemic. As a result, more than 100 registered nurses across the country have lost their lives. I urge every member of this committee to do everything in their power to ensure that nurses and other frontline workers get the protections we need immediately. We need an OSHA emergency temporary standard right now. We need the president to use the Defense Production Act to increase production of PPE right now. We need that PPE to be distributed to our facilities immediately. We needed these protections 3 months ago, and we need them now. It's the only way to ensure that nurses can do our job safely and protect our patients, our families, and our communities. Thank you.
Thank you very much, Ms. Harden. Mr. Coates, you are now recognized.
Good afternoon, members of the committee. I first want to say thank you for allowing me to testify in front of you today. I'm going to actually try to give you a little bit of insight into what it's like to be an essential worker since the onset of this coronavirus. I am a bus driver for the City of Detroit Department of Transportation. I've been on the job for about 4 years now. I'm a member and proudly member of the Amalgamated Transit Union Local 26. And on behalf of all the transit workers in Detroit and across America who are on the front lines right now, putting their own lives at risk, I appreciate the opportunity to give you some insight into the day in life of a bus driver in the middle of this pandemic. I'm also here today on behalf of bus drivers who can no longer speak, like my best friend, Jason Hargrove. Jason was not only a bus driver, Jason was a loving husband, a loving father to 6 wonderful children and 3 grandchildren. Jason, on March 21st, posted a Facebook Live video that has since gone viral, talking about the fact of a woman in the middle of this pandemic just stood up in the back of his bus and openly coughed several times. And in doing that, it somewhat got him infected to the point that Jason, 10 days later, on March 31st, died from the coronavirus. And in that, Jason was in the hospital alone. And just the pain of knowing that he had no one around him is what's really hurting his family and myself also, and is also his fellow coworkers. Jason was very, very loved with the DDOT organization. He was trying to do things to make sure that this city moved and moved freely like it's always supposed to. But driving a bus in Detroit has always been a tough job, even before the coronavirus. I know this for a fact because I know personally drivers that has been actually driving the bus, and while the bus is in motion, they've been pulled out of the seat and actually attacked. People don't like paying fares or being told about regulations, and they get angry about the service. So they often take out their frustrations on the drivers. ATU members all across the country have been assaulted. And the reason being is because we have no sort of protection or barriers to actually ward off any type of attacks from any passengers. Now we're being attacked by an invisible enemy. I go to work every day afraid, not knowing. I go to work every day hoping that I don't bring this virus back home to my family. And the reason that I'm really afraid is the simple fact that I go to a stop every day not knowing who's going to be at that actual stop. I don't know who they've been in contact with. I don't know if they have the virus themselves. And the biggest fear for me while I'm driving, trying to pay attention to the road, is you'll have someone in the back either sneeze or cough. And if you've ever been on a city bus or public transportation, we look at it as a 40-foot incubator. You have no way of practicing social distancing on a coach. The way that the CDC has set up guidelines, there's no way for a bus to actually be able to have any sort of social distancing. They try their best the way that they've arranged the seating chart, but that never works because you still have people that are actually either coming out with no mask or they're just out riding the bus because it's just free. And most of the people that we're picking up are homeless people. We do have some essential workers where we have either the grocery store worker or we have the nurse that we're picking up to go to our major hospitals here. We have post office workers, but a lot of the times we have a lot of security officers that we are picking up. So those two are essential workers that I'm proud to say that I can go and make sure that they get from place to place. In Detroit, they've now started providing masks for the actual passengers. As the passengers enter through the rear door of the bus, they're actually able to take a mask. But me working in the inner city, we have a box of 50 masks that by the time I do a round trip, those masks are gone. So now I'm riding the bus all day long for 8, 10, 9 hours a day that no masks are being provided for passengers that are actually getting on the coach. Now, personal protective equipment has been a constant battle. Everyone is having those issues. And with me working with Detroit Department of Transportation, we never really had a plan in transportation to even work on or try to deal with a pandemic such as what we're going through right now. So everybody's struggling to get the actual PPEs. So it's really hard for us as transportation workers to know what to do. We actually were finally able to get a hold of some N95 masks. And at that time, every driver was issued out one N95 mask. But in receiving those N95 masks, we were never told how to care for them, those N95 masks. So me, myself, personally, when I feel like I go out on my run for the day, I feel like that mask has been soiled, it's contaminated. It's no more good for me. So I don't know what to do the next day. I never knew how to actually clean the mask to even be able to go on to the next day. So what I did personally, and my wife, we actually ordered N95 masks. And those masks were ordered in April. And we just recently, as 2 weeks ago, got that order of N95 masks. So that entire time, I've had to do makeshift masks from a bandana, which I know is not safe. I've had surgical masks. I've held on to my N95 mask that I was issued initially. But knowing that I've done that whole entire time, it's had a great fear inside of me at that point, to the point where I was just afraid that I'm still going to bring home that virus. And what I do actually, I come home from work, is I head directly to my washroom, take my uniform off, and I literally wash my uniform every single day just to make sure that I can get off whatever I've held on to for that entire day.
Well, thank you very much, Mr. Coates. Thank you so much for your testimony here today. With that, we now recognize Ms. Wilson.
Good morning. To the members of Congress, I would like to thank you for the opportunity to speak on my experience of working the epicenter of COVID-19 in New York and how it's affected me personally and my family. My name is Diana Wilson. I'm an emergency medical technician that has been working for the New York City Fire Department for the past 17 years. I'm a mother of 2 boys, 11 and 15, a daughter to a father who has become bedridden due to a stroke, and I recently became a widow in 2019, leaving me to pay my mortgage on my own. Graduating from the FDNY Academy in 2003, I took an oath to provide pre-hospital care to those who need assistance in an emergency event. Becoming an EMT was the beginning of my career, and I'm currently waiting to be accepted into the paramedic program, which is my goal, and one day rise to lieutenant or captain. Since COVID-19 plagued the city, my life and dreams have been put on pause. With great sacrifice, I serve the citizens of New York City. During the early days of this pandemic, I've sent my sons to live with loved ones to keep them safe from contracting this deadly virus. It's been 10 weeks since I've seen my children. What I've seen in the last 6 to 10 weeks was unprecedented chaos. Attempting to drop off patients to max capacity emergency rooms, requiring EMT crews to travel longer distances for 911 calls. Doctors informing EMT crews they have no more beds, and stressing they had no more ventilators for patients who required them. EMTs and paramedics are being mandated for 16-hour shifts, leaving us mentally and physically exhausted. On a normal EMS shift, we respond to 1 or 2 cardiac arrests. Since COVID-19 has ravaged our state, we are now responding to calls by 6 to 10 cardiac arrests in an 8-hour tour. Despite our best efforts to save lives, we are finding patients dead in their homes, sometimes even in their cars. This pandemic is dire. We are doing our best to combat this invisible enemy, and to do so, we need the proper safety equipment. In order to make good on our oaths as EMTs and paramedics, we need to be provided with the personal protective equipment to protect ourselves. Coming to work not knowing if I was going to be provided a medical N95 mask was not only extremely stressful, it endangers our families. I want to be clear of who we are. We are EMTs, we are paramedics, we are first responders. First responders. We are the first to enter a patient's home that is suspected of having COVID-19, while firefighters and police officers secure a perimeter. We treat our patients with dignity, provide medical attention, and reassure family members that we would take care of our loved ones and their loved ones. We train for Ebola. We've trained for active shooting scenarios. We failed on a plan or training for this pandemic at any scale. There were other countries who had strategies to respond to this type of scenario, and we were grossly unprepared. New York City is one of the main hubs for international travel. If we only had the information and the preparedness that we needed, like all the other trainings that is federally funded, we could have saved more lives. We are fighting an invisible enemy that has killed thousands of my fellow New Yorkers and Americans across the country. Let us remember how EMTs and paramedics during 9/11 affected our department. Remember how members were being told that the air quality was safe and still experiencing staff dying to this very day. Fast forward to today. Responding first to this virus. When does EMS get the PPE we need to protect ourselves and save lives? When does EMS get the pay they deserve for being first medical responders? And when and how would hazard pay reach us? The government failed us by not protecting first responders by providing us with a plan and PPE. We are haunted by our choices and the patients we could not save. Behind the mask and uniforms, we are people with families, financial responsibilities, and civic duties. As we try to get a hold on longer shifts, we are now transitioned into 12-hour tours. This should have been implemented when the call volume had reached 7,000. We are stressed and overworked for the better of 10 weeks. Let us put our political differences aside together and make a step in the right direction. Pledge to support EMTs and paramedics. Get first responders the PPE they need and the financial backing they require to not only save lives, but to also live them. Provide the adequate pay for our EMTs and paramedics. When no one else would, the essential first responders did. Thank you.
Thank you very much, Ms. Wilson. Now we'll hear from Mr. Aranda.
Good morning. I'd like to thank Chairman Clyburn, Ranking Member Scalise, and all the members of the subcommittee for allowing me to share my story today. My name is Marcos Aranda. I'm a janitor and proud member of SEIU Local 87. As a janitor for the last 10 years, I can tell you that my job has always been essential to protecting the public's health and safety, even before the COVID-19 pandemic. COVID-19 has made it harder for janitors to do our job safely. We're coming into frequent contact with objects touched that could be contaminated with coronavirus. I use regular latex gloves and dust masks, but nothing medical grade. I'm lucky there are many janitors out there who work without PPE. We now have to make sure we disinfect every frequently touched surface, from phones to elevators to microwave handles. We do a detailed job to make sure that people coming into work in our buildings during this crisis stay safe. I know firsthand that it's easy for janitors to come into contact with the virus, but it's harder to deal with the consequences. My coworker came to me recently for help. He was sick at work. He turned out to have contracted the coronavirus. I did what I could at the moment and got him help. This took a huge emotional toll. I stayed home for 2 days afterward, but then I had to return to work. Janitors don't have the option of working from home, and many janitors don't have paid sick leave. If they stay home, they don't get paid. I'm lucky that I have a union and we fought for our paid sick days. Now when I go to work, I'm not only worried about my health, but also worried about the health of my family. My wife and I live with our 6 kids, my mom, my sister, and her 2 kids. Thankfully, no one in our big family has been infected, but COVID-19 is already hurting working families like mine without getting us sick. Raising our big family in San Francisco was a challenge on 2 paychecks before the pandemic. And now my wife was laid off in March, just as the San Francisco stay-at-home order went into place. Now I'm trying to raise our family on 1 paycheck alone, and the pandemic has made it even tougher. When the kids were in school, we could count on school lunch program, but that help isn't available right now, and the cost of covering the extra meals adds up. It's also a challenge with other expenses. We're doing so many more loads of laundry to disinfect masks, our clothes, to make sure we don't bring the COVID-19 back into our home and to keep our children and families safe as possible. But we're cutting corners. We're cutting corners where we can. Recently, we got into a car accident. Luckily, no one was hurt, but the car was totaled. And now with so much uncertainty, we've decided to make do without a car. No one knew what to expect when our families first went into quarantine. I was actually happy about having my kids around more. We normally have different schedules because I work nights and they're at school while I'm at home. I don't have a chance to see them enough. Today, I worry about feeding them, keeping them healthy, making sure they have what they need in the future. And my story isn't unique. I heard of union janitors like myself, over 25,000 across the country who have been laid off despite being essential. And my company just laid off 200 workers in 1 day. I have no idea if I'll have a job in a week or 2. Many parents working in essential jobs are also worried about the next few weeks, months, and years because of the pandemic. Now more than ever, we need Congress to take action to protect all workers by requiring higher pay during the crisis for all working people who are putting their health at risk to go into work, making sure we have sufficient PPE, protecting our right to speak out about unsafe conditions, and respecting the right to join together in a union. Extending the $600 unemployment benefit boost until the crisis is truly over. My family is only able to hold things together because of this extra help. And making sure that every worker, with no exception, has paid sick days if they are sick, self-isolating, caring for loved ones. People who are exposed to COVID-19 or someone with symptoms like I was shouldn't be forced to go to work because they simply can't afford not to. They should be given an option to self-quarantine and get tested to keep all of us safe. Thank you.
Thank you very much, Mr. Aranda. Now, Dr. Akers.
Thank you, Chairman Clyburn and Ranking Member Scalise, and members of the committee for the opportunity to speak today and share my story. My name is Dr. Shanti Akers, and I am a pulmonary critical care physician that lives in Albany, Georgia. I have had the privilege of being part of this community for 2 years, and when I first moved, I learned that people in this town look out for each other. I work at T.B. Putney Memorial Hospital, a 448-bed hospital in Albany that has 38 ICU beds. We are a rural hospital that supports the surrounding counties, many of which do not have a hospital themselves, and we provide critical access to Southwest Georgia. As 2020 began, news outlets started to report cases of a new respiratory illness. Wuhan, China felt oh so very far away, and this illness seemed unlikely to reach us in Southwest Georgia. We had our first contact with COVID-19 during the last week of February and first week of March, and we didn't even know it. We were informed on March 10th by an Atlanta-based doctor that a patient we had treated had turned out to be positive. We were shocked by its abrupt entrance into our lives, and the virus had been spreading quietly for 10 days, and very quickly, what started as one case spread like wildfire. We learned that a funeral had become a super spreader event, and one case quickly became 5 and then 15 until it overwhelmed our hospital and exceeded our 38-bed ICU capacity. We started to board critically ill patients that did not have COVID-19 in our surgery recovery room, We filled ward after ward until we had at least 5 floors dedicated to the care of these patients. We were forced to keep patients who were critically ill on the medical floor as we ran out of space. Those early days were scary and intense. We knew so little about it and how it was spread or how to treat it. We listened for guidance from colleagues who had experienced treating COVID-19, hoping to learn anything we could. Without the resources of a larger academic system or other nearby hospitals to buffer our caseload, our community did what it did best. We looked out for each other. The hospital shut down elective cases to pool resources and limit transmission. Doctors and nurses and staff shared what information we found. We had local construction firms donating N95s as it became clear that PPE was limited. Local churches and businesses provided meals to frontline workers. And throughout it all, our hospital supported its staff, provided free childcare to any staff member that needed to work. And the hospital administration was there every day to make calls and went through extraordinary efforts to obtain equipment and PPE to provide to its clinical staff. Efforts that in reality it shouldn't have had to make, as that equipment should have been readily available. What PPE we had stockpiled to last 6 months lasted 1 week. We were and still are forced to make that supply stretch. This time took a toll on all of us. Staff members caring for COVID-19 isolated from their families. We took extraordinary precautions to decontaminate ourselves to ensure we didn't become carriers to people in our community or to our families. We took very strong precautions even in hugging our children and feeling that was a reckless act in and of itself. I spent many weeks not seeing my children awake because the hours this pandemic required. I minimized physical contact with my family in case my PPE had been adequate, and I updated my will. My husband bore the brunt of my absence, but his unwavering support of me is what kept me calm through this storm. I stayed awake at night, even after working long days, thinking of what we could try next to help save our patients. Even when I tried to rest, it was impossible to avoid COVID-19. It was in the news, social media, and on people's minds constantly, and there was no respite. Every day, a new piece of information came out, sometimes contradicting information from the day before. We were close to running out of critical drugs that provided sedation for patients on ventilators, drugs that would keep them safe. I wish I could explain to you all how terrifying it feels to be that helpless. I have been trained to protect and care for my patients so that they overcome a critical illness. And in spite of all of our best efforts, some patients died no matter what we did, and we could not change that outcome. It didn't matter if they were young or old, this virus did not discriminate. There were mothers, fathers, grandparents, children, members of our community. I've had to call families at home, some of whom were even sick with COVID-19 themselves, to let them know their loved one had passed. Some families lost multiple generations in the span of weeks. Through it all, every single person who works at Phoebe Putney Health System knew we could count on one thing, and that was each other. And day in and day out, we picked each other up. We mourned the loss of our patients as some took their last breaths, knowing that their families could not be there and could not touch them. We cheered with them when they took their first steps out of the hospital. We were fortunate to receive support from Governor Kemp and the Georgia National Guard, and when we saw the Guardsmen come into our building, a huge weight started to slowly lift. I cannot amply express how grateful and appreciative we were for all their help. But we need more. We need more PPE. We need more organization on a state and federal level. As cases start to come down here, we know another wave could come at any time, but we are certain of one thing. We are Phoebe Strong, and we will get through this as a community. But if it can happen to us, it can happen anywhere, and we are asking for your support. Thank you for your time.
Thank you very much, Dr. Akers. Mr. Pettis.
Mr. Chairman Clyburn, Mr. Ranking Member Scalise, members of the committee, good afternoon. My name is Steve Pettis, and I'm a New Orleans restaurateur and managing partner of Dickey Brennan & Company. We operate 6 restaurants in New Orleans and have an extended family of over 500 coworkers. With our teammates, we have run our restaurants for decades, and so many of our coworkers have been with us for over 20 years, some more than 40. Our success has allowed us to offer our team a broad array of benefits, such as health and dental insurance, educational assistance, assistance where team members receive up to $6,000 to help them buy a home, 401k, paid time off, and so many others. Unfortunately, all of that has been suspended for now, but just for now. During the time we've been closed, we have provided thousands of family meals to those in the hospitality industry and musicians. New Orleans has over 80,000 hospitality workers. All were welcome. Jim Beam, Crystal Hot Sauce, Community Red Beans provided the funds for that food, and the PPP provided the funds to pay the teammates to prepare those meals. On behalf of my coworkers, the restaurant industry, and myself, I thank you for your swift action in putting the payroll protection plan into place. This act, as intended, allowed small businesses such as ours to maintain employee base and salary levels. When the Payroll Protection Act was enacted, I doubt anyone would have believed the length of time it has taken for so many small businesses to reopen. 2 days ago, we entered our 5th week of the PPP payroll, and on the same day, opened our 30-year-old flagship restaurant, Palace Cafe, for the first time in over 2 months. As per governmental regulations, we opened at 25% capacity and did about 3,500 for the day. Last year on that same date, we did over 25,000 in sales. We intend to open our largest restaurant, Bourbon House, next week. The remaining restaurants will have to wait until we have enough guests to justify opening. Our PPP period runs out on June 18th. If the 8-week period remains in place, we will likely have to lay off hundreds of our teammates. Once again, the emotional toll this will take on those laid off and those remaining will be immeasurable. Because of the current 8-week period, we are forced to try to open restaurants while still being limited by our city to 25% seating capacity and no customer base. I don't blame the city. It's just where we are in the recovery process. We've been through Katrina, the BP oil spill, and other disasters. We understand the recovery process and the time it takes. But as a cash flow business, we are out of time. I would ask Congress to extend the PP period to 24 weeks. This would hopefully provide enough time for our customer base to recover and allow our business and employee base to grow at the same rate. We can stretch an average of 2.5 months of payroll into 6 months, but we cannot spend it properly in 8 weeks if we are forced to be closed for over half of the time that we're in the PPP period. We are not asking for more money. We're just asking for more time. The second restriction I would ask you to reconsider is the 25% limit on rent, utilities, and mortgage interest, and 75% wage and salary requirement. If you must keep the categories of rent, utilities, mortgage interest, and payroll, then so be it. But please lift the ratio restrictions on how we spend these funds. Allow American entrepreneurs to do what they do best. Work hard, be creative, stretch dollars. And the third change I would ask of you is to extend the amount of time for small businesses to repay the unforgiven portion of the loan. Though the 6-month deferral and 1% interest are very favorable to the borrower, the anticipated financial position of our future will prevent us from being able to pay back any loans in such a short period of time. I am very sensitive to the impact of this disease. My wife is a nurse. I lost my aunt on April 28th. Our phone and spoke to a friend just a few days later. In summation, please know that we are grateful for the help provided us thus far, but I also know that for so many of us, businesses and individuals, we are still 4 fathoms below the surface and gasping for air. I am confident that you, as America's leaders, will find a way to avoid the compounding of a medical disaster into an economic catastrophe. Thank you for your time, and thank you for your service.
And thank you very much, Mr. Pettis. We now recognize Ms. Shepherd. I see Ms. Shepherd, but I'm not hearing her. Can someone unmute Ms. Shepherd? We're not hearing Ms. Shepherd. I'm sorry. The question. So we do. Well, while we work on trying to get Ms. Shepherd,
Mr. Shepherd, can you hear me?
I cannot hear Ms. Shepherd. Do we need time to get connected to Ms. Shepherd? Can we go on to Q&A, come back to her? While we work on trying to get Ms. Shepherd squared away, let us go to the members for questions. And let me begin the questioning by asking one myself. I would like to know, in fact, the question I had, the sequence caused me some problem, but let me yield to the ranking member, Ms. Maxine Waters, for questions.
Chairman, I'm here.
Oh, Ms. Shepherd?
Yes, sir.
Please, go ahead with your statement.
Thank you, Chairman. Thank you for members of Congress for having me. I am Leilani Jordan's mom. She was a 27-year-old ADA, disabled, very loyal frontline worker. Leilani went to work to help the elderlies and to help the individuals in the community. Can you hear me, Chairman?
Yes, we can hear you.
Okay.
We're having problems seeing you.
Okay.
You can tilt your
There
head
we go.
now.
Okay.
Very good.
Okay. Leilani is was a 27-year-old ADA disadvantaged, with cerebral palsy, frontline worker, and she worked at a supermarket, grocery store, Giant in Largo, Maryland. Leilani loved going to work to help seniors in the elderlies and the disadvantaged. Leilani contracted COVID-19 due to the lack of resources with PPE at the time when she was working. She was a butterfly. I call her my purple butterfly. She went to work to help, regardless if it was helping the seniors to get what they needed to get, helping the seniors to get to and from their baskets, wherever the case may be. She went from being the hero at her grocery store to being the hero in the CCU unit, okay? Where I witnessed, they allowed me in there, and I witnessed her stay, over 20 doctors and nurses trying to save her life. Over 20 doctors and nurses scrambling, trying to get her off of a ventilator, trying to get her the right medical supplies. Why couldn't we do that in the beginning? Why couldn't a simple PPE be provided to the grocery store workers, the gloves, the sanitation, the disinfectants that they need for cleaning the bathroom, all of the items that she needed just to do her simple job? Leilani was a superstar at where she worked. She loved going to work just to help the elderly. She says, "Mommy, I want to go to work. No one's showing up. I want to help the elderlies." I still hear my babies cry to this day. I still hear her cry, saying what she wanted to do. She risked her life to help seniors, to help those that are disabled, to help those that are homeless. There's so many people that go to the local supermarkets and none of the resources that they needed, which is the simple PPEs, they should have been handing them out to the workers. Did they have? Cashiers didn't have the gloves that they needed to receive the money or to receive the transactions that were possibly contaminated. of some sort. No one knows. But my baby, my purple butterfly, is gone. She rests now in Arlington National Cemetery. And I love her so much. I just want Congress, members of Congress, we've got to do a better job at keeping people with disabilities, people, our American people, seniors, keeping them safe. You can't see COVID-19. You can't see COVID-19. You don't know where it is. But I'm asking if they could do a better job at protecting the doctors and the nurses that allowed me the opportunity for my daughter to die in my arms, to allowing me to touch her one last time, allowing me to know that my disabled daughter with ADA accommodations did not die in vain. We've got to do a better job, Mr. Chairman. There's so many seniors that are passing away and people with disabilities, and they don't have any income that can substantiate them to buy these resources. We've got to do a better job. I'm asking you to please hear my cry as a mom.
Thank you very much, Ms. Shepherd. Thank you very much for your service to this country. And we all join together in saying how sorry we are for the sacrifice that you are making on behalf of this country today. So thank you very much for your testimony. We will now go to our members. Each one will have 5 minutes to ask questions. Now, please, members, remember to unmute yourselves when you get ready to ask your question. And let me say to our essential workers who are here that please unmute yourselves when you get ready to answer the questions. I'd like to start the questioning with a question to Mr. Coates. Mr. Coates, I want to thank you for your critical work, especially during this pandemic. I'm a great advocate for mobile testing in order to get to critical areas of our population, especially in rural communities, though the same in many isolated urban communities. I'd like to know exactly what inspired you and your good friend, Mr. Hargrove, whose that little episode on the bus. I still think about it daily with him. And so I feel a lot for your sacrifices, but I'd like to hear from you. Exactly what inspired you to continue to do this work, knowing full well how dangerous it can be to you and your family.
Well, thank you, Representative Clyburn. My reason and my for still going to work every day on a daily basis, because as a child, I was taught by my mother to be proud of everything that you do. Be proud in what you do. So what I actually do every day is I take pride in the city that raised me. And I know that people still have to get around the city. So even in my fears and even in my quest to try to get over the hurdle of being afraid of this coronavirus, I still know that I have a job to do because I am a public servant. I took a civil service exam, and I know that I'm a person of service, and that's the reason that I go and do what I do every day is because I love the city and I love my job, and I just want to make sure that when the city sees me, they see the face that wants to make sure that they're getting from place to place in a safe manner. And like I said, I'm a proud member of the ATU, and we love what we do. And that's making this city of Detroit move the way that it's supposed to move. So that's what inspires me every day to go to work, is just to know that there are some people out here that need us. You know, even though we don't really want to be out here because, like I said, we don't know what's going to happen, we actually go because we know that we have people that actually need us. And that's what inspires me to go to work every day.
Thank you very much, Mr. Coates. Ms. Shepherd, I, like so many in the country, followed your daughter, the reports on your daughter. And I'd like to ask you, do you feel that she was given the enough or the proper personal protective equipment going to work every day as she did? You need to unmute yourself, I think, Ms. Shepherd. We're not hearing Ms. Shepherd again.
Can you hear me, Mr. Chairman?
I hear you now, Ms. Shepherd.
Okay. No, she was not provided any PP&E at all, as well as the cashiers or anyone in the store. And she said to me, Mom, we have to bring our own hand sanitizer. Well, by that time, everywhere in the Prince George's County in Maryland, it was very difficult to get just a basic hand sanitizer, let alone a facial mask, or let alone any kind of gloves. No, she wasn't. Not as a disadvantaged worker, frontline worker. She wasn't given the opportunity, and neither were any of the other staff members there. So she wasn't given the opportunity there at all. And the thing that gets me is this is my daughter's last paycheck. Her last paycheck was for $20.63.
Thank you very much. I remember the reports of that paycheck.
$20.63. Do you know how many boxes of gloves that we could have bought with this? They come like 100, 200 in one box. The resources need to be available. $20.63. We can buy how many boxes? And now you can't even buy one box. You can't even buy 10 face masks with $20.63, Mr. Chairman.
Thank you very much, Ms. Shepherd. Mr. Ranking Member Scalise, I'll yield to you.
Thanks again, Mr. Chairman. And also, once again, just want to thank all of our frontline heroes who are here on the panel. For those of you who had friends and just these powerful stories, our prayers go out to all who've lost their lives and who've struggled through this hidden enemy. We know what's out there. We're working every day to continue to learn more about it, finding cures, diseases, cures for the disease, therapies, as well as a vaccine. I know we've put a lot of money out there within CDC and NIH to find a cure, because ultimately what we want to do is to, while we're working to protect people, we want to make sure that we cure this and we find a vaccine so that people know as it's out there, we're going to be able to go about our lives safely. And that's really been the focus, is trying to improve safety for everybody. But there's also a component of this, and I know some of the witnesses touched on this. I think it was Ms. Wilson who said, if only we had more information, we could have saved more lives. And that's probably the thing that makes me the most angry as we're working. And so much of the work we've been doing to get these vital resources, to ramp up production of PPE, to get testing capabilities out there, to buy more ventilators, which the president used the Defense Production Act to go and buy more companies like GM that were making ventilators to solve that problem. But as we've been doing all of this, working together to get all of the resources out there, we also know that China knew about this long ago and hid it from the world. They hid it from the United States. When we wanted to send our medical team in, and we had some of the best and brightest in the world that were ready to go to China to find out what was really going on, as we're hearing anecdotal stories, and the Chinese Communist Party kept us out. They kept the world out. They lied to the World Health Organization. And that cost us lives. That cost the world so many vital days that we could have used to stop the spread. But now we've got it here, and we know we've got to focus on ramping up production of things like PPE. One thing, Mr. Chairman, I know we've talked about the need to hold hearings on these areas, but About 80% of the world's supply of PPE prior to COVID-19 was made in Asia, and much of that in China. And of course, we saw what China did. China literally stopped companies like 3M, American companies who were making PPE over there. They wouldn't let them sell it to us here in the United States. These are things that outrage me. I think it outrages so many people. And it focuses us on saying we need to now bring more of that manufacturing back to America. I know the president was in Pennsylvania just a few days ago highlighting a PPE manufacturing company that's starting up there. We need to encourage more of those vital life-saving supplies to be made here so we don't have to rely on a country like China who literally shut us off so that we couldn't buy it. And even if you can buy it, the prices skyrocketed. So those are all things that we need to focus on, because as we're combating this disease, we're seeing heroes. We celebrate these heroes, but we need to do more to bring that back here so that we can continue ramping up those numbers. I do, Mr. Chairman, want to highlight a few hometown heroes in my community, and we've seen so many. Ochsner Hospital in New Orleans, the biggest outbreak when New Orleans was one of the biggest hotspots in the country. Ochsner Hospital System treated more COVID-19 patients than anybody in the New Orleans area, and they've done a phenomenal job, Warner Thomas and his whole team. But there's some people over there, like Savannah Stewart. She's an RN, and she's actually somebody who, she was born without a left forearm. And she talks about this a lot, about how she didn't use it to have an excuse or to mope around. She said, you know what, with my disability, I'm just going to go out there and work even harder. And she's one of those inspirational people, and she's treating so many COVID-19 patients. They actually sent her to treat the most serious, the people that are on ventilators. And she's out there every day doing a great job. Kyle Edwards, who also works at Ochsner, he's a tech, and normally he's in the orthopedic division, but he chose to go and work with COVID patients because he knew that there were other people that were higher at risk, and he wanted to go out on the front line himself to put them less at risk to help COVID patients. Leslie Gates out at Lakeview Regional Medical Center, the things that she does, they call her the singing nurse, because even though she herself got COVID, she is out there helping other people too. I just want to ask, I know Mr. Pettis is there. From the restaurant side, there's so much being done by so many people to make not only the workplace safer for their employees as we safely reopen, but also for customers. If Mr. Pettis can maybe touch on some of the protocols that they've seen and learned about to make things safer for their workers and for customers who come in to restaurants.
Thank you, sir. Well, as I mentioned, my wife's a nurse, and so I got to put her to work again for us and helping develop our sanitation protocols. All employees are coming in through the back door, myself included, everyone, and take our temperature. I was 97.3 this morning. Record our temperatures, ask if we are feeling well, any exposures to anyone that is suspected of having COVID-19. We have everyone in the kitchen wears masks and gloves. We have an all clean call once an hour. We write down all surfaces in the kitchen with sanitizer. In front of the house, we have divided. We have to rework our strategy with regard to service so that customers only come in contact with one person. As you walk in, there's a sign on the front door that says, please, if you're not feeling well, please refrain from dining with us today. Hope you join us when you're feeling a little better. They come in, there are sanitizer stations all over the place. They at the post stand, there's a QR code that allows our guests to download our menu so they don't have to touch a menu. If they want a menu, we do have disposable ones available to them. Seating is 10 feet apart for tables. As I said, we have single point of service, contact with servers. The food is delivered, and then when it's picked up, the person that picked it up it goes back. They wash their hands, sanitize their hands again, and go back. Front of the house staff wears masks, and we have one person who's in the front of the house who's dedicated. Their only job is they're the sanitation engineer, and so they walk around and just clean the entire time. They're wiping down with sanitizer throughout the entire shift.
Well, thanks,
Well,
Mr.
thank you very
Pettis. I
much, Mr.
appreciate
Pettis.
all of those precautions. And Mr. Chairman, thank you for this time. I yield back.
Thank you, Mr. Ranking Member. We now yield to Ms. Waters, Chair Waters.
Thank you very much, Mr. Chairman. I thank you for holding this hearing. This may be one of the most important hearings that we could possibly have. I also would like to thank all of our panelists for participating here today. And I'm especially thankful to Mr. Arando, who is a fellow Californian, who's here today explaining to us what is happening in his workplace. Mr. Aranda, you are a custodian, performing a vital and essential service, protecting everyone in your workplace from potential coronavirus infection. All the while, you're exposing yourself to possible infection. We have learned from medical experts and environmental experts that we can assist in avoiding coronavirus infection by keeping our surroundings clean. Keeping our surroundings clean, that means scrubbing, wiping, disinfecting surfaces, and keeping down dust. We've learned that the virus clings to dust. Cleaning is absolutely necessary. So this kind of cleaning is what you do, exposing yourself to bacteria as you clean floors and ceilings, dirty corners, and wiping away the coughs and sneezing by others that land in surfaces in the workplace. So despite these essential services of custodians, custodians are oftentimes some of the lowest paid workers in our society. As I listen to you describe your awesome responsibilities, not only in the workplace, but in your home, where you're taking care of your family, your extended family, your children who are not in school, where they would be receiving some assistance with lunches and food, and now you have to stretch your budget in order to make sure that food is kept on the table. I support you in calling for your job security. I support you and organized labor in fighting for an increase in pay. And I want to know whether or not, even if you could get an increase in pay, would it be helpful to you right now to get a bonus so that you could buy the extra food that you need for your children? We've talked a lot, and we hear people talk about bonuses. Of course, we want continued extra pay, but a bonus right now would help. What other financial pressures are you experiencing?
There's difficulties even now without a car, having to get to the grocery store. You know, I'm having to pay somebody to give me a ride there or something. Providing our own masks, that's been a big deal. Gloves, we have to buy our own gloves, not for work, but just being at home or, you know, going out grocery shopping. It's been financially draining.
Well, Mr. Armando, will you tell people what it means to go shopping and want to purchase certain things for your family, but knowing the budget won't allow that, and you have to have alternate things? You're looking for cheaper food, you're looking for cheaper packaging. Will you explain to people what that's like to be in the grocery store doing that?
Well, it's kind of embarrassing. I feel like, you know, I'm a proud person. I feel like I should be able to provide for my family, and I feel like I am doing the best I can. It's a little more difficult and time consuming, having to look through the prices, try to maybe look generic brands, and we're having to touch more things on the shelf, which is kind of, it makes me nervous. I don't know if that somebody has, you know, what the virus has touched that item or not. It's exhausting mentally. It's just not an easy task.
It's not an easy task. You know, I know what that's all about. I come from a family where we had 13 children in the family. And I can remember, as your children probably do now, pointing to a box of cereal that may cost $5 that you can't afford. What do you tell them?
It's tough trying to give them what they want and what they need, and making them understand that I try to put the facade that everything's going to be okay, but it's difficult trying to illustrate that to them without showing my emotions that I'm having behind all this.
And I can see that, and I can feel that. And I want to thank you for being here today. And I want you to know that I stand with you and will do everything that I can as a member of Congress to be an advocate for increased pay. And if you have to walk the picket lines, I'm going to be there with you. I want you to know that I'm also advocating for you to have a bonus at this difficult time so that you can attend to some of the financial pressures that are confronting you. So thank you for participating and helping everybody to understand what you and many other families are going through. And with that, Mr. Chairman, I yield back the balance of my time. And even though my other panelists may not be able to see me and my picture has not been exposed, I'm Maxine Waters and I'm here for you.
Thank you very much, Chair Waters. We now yield to Mr. Jordan.
Thank you, Mr. Chairman. Let me thank our witnesses as well for being here today, especially Ms. Shepard and Mr. Colts, who've lost loved ones and friends. Dr. Rainey, 9 weeks ago, the American economy shut down. Why was the shutdown done?
Mr. Jordan, Congressman Jordan, thank you for the question. I certainly was not in charge of the decisions about the shutdown, but I will say that here in Rhode Island, as we saw our case counts climb, we made the decisions to put our kids into distance learning, to cancel elective surgeries, to cancel large gatherings in order to flatten the curve of this infection so that our hospitals across the country would not be overrun with sick patients and we wouldn't all be facing situations like New York City had.
Right. So the end goal was to make sure our healthcare system was not overrun. Is that accurate?
So yes, it was accurate that we put social distancing measures in place in order to slow the spread of the virus so that we could have more time for science to make sure that our hospitals were not overrun and to keep people safe.
It wasn't because we had inadequate testing. Right. It had nothing to do with testing. I mean, on March 15th, Dr. Fauci says we want to blunt the curve so as not to overwhelm our hospital system. We had Governor Cuomo say on March 16th, with the rate of increase in the number of cases portends a total overwhelming of our hospital system. That's why we're going to close the valve, to use his word. March 19th, Governor Newsom said we are looking at the Delta that requires 10,000 hospital beds. So the goal was to make sure our hospital system was not overwhelmed. Is that accurate?
So, Representative Jordan, the first goal was to make sure that our hospital system was not overwhelmed.
No, I'm not talking about I'm not talking about a sequence of goals. I'm talking the reason given to the American people why the economy was shut down, why there were stay-at-home directives given. It was to make sure our hospital system was not overwhelmed. Is that accurate?
Yes, sir. So I would obviously defer to the governors of each state as to their own reasons for shutting down states.
Have we accomplished the goal?
So the virus is still amongst us. We still have this, as you would say, our invisible enemy. And our goal now is to keep the most people safe so that we don't run the risk.
I'm always for keeping people safe. I'm always for saving lives. I'm just saying we were told the goal was not to overwhelm our hospital system. Did we accomplish that goal in the past 9 weeks?
We've accomplished it in some places and not in others, but we have certainly slowed the curve. And even in the most overwhelmed areas, we are starting to see decreasing. In most areas, we're starting to see decreasing case counts, although there are still areas of the country where case counts are climbing and hospital inpatient censuses are still climbing.
Okay, so if we've accomplished the goal, it seems to me it's time to get back to work. Do you think we haven't accomplished the goal?
So, Representative Jordan, I would love nothing better than for my kids to go back to school, for summer camps to be open.
Same here.
Here in Rhode Island, we are restarting elective surgeries. We are opening restaurants carefully, and we're doing it in a data-driven approach.
Okay. Mr. Pettis. Yeah, so we should be going back to work. You agree with that?
We should be going back to work using data and science to inform this so that we don't undo all the hard work and all the sacrifices that Americans have made over the past 10 weeks.
Yeah, I mean, it seems to me if the goal was to make sure our hospital system wasn't overwhelmed, in the month of April alone, we had 1.4 million healthcare workers lose their jobs. The ship that was sent to New York Harbor sailed out of New York Harbor 3 weeks ago. It seems it is time to get the country back to work. Mr. Pettis, would you like to go back to work?
Representative Jordan, I would love to go back to work. I would love to have the customer base that would allow us to do so.
I'd love to have those 500 employees of yours get back to work too, wouldn't you?
It's surprising how many are excited to get back to work. We just need to get there.
Yeah, let me ask you one other question here, Mr. Pettis. 2 weeks ago, the Democrats' first action they took on this committee was to send a letter to Universal Stainless and Alloy Products and say, hey, give back your PPP dollars because we think you don't deserve those. Of course, we had Democrat members of Congress say they did deserve that money, and if they had to give it back, there were going to be a number of steel workers lose their job. Last week in the first hearing, contrary to what Dr. Rainey just said, in the first hearing, the Democrats' first hearing, their first witness gave us false information and said that it was inadequate testing. That was the reason for the shutdown of our economy and the stay-at-home directives. And of course, this week, we write a letter, Mr. Scalise and the rest of us write a letter to Mr. Clyburn, and we say we want the head of the World Health Organization to come here. And the response we get back from the Democrats was, quote, this committee is not directed to focus on the origin of the virus. So, Mr. Pettis, someone who's had to lay off 500 employees, would you like to know what was the cause for you to have to lay those people off of work? Would you like to get to the heart of this and figure out what China did, what they knew, when they knew it, and why they didn't tell us? Don't you think that's important information for the American people to have?
I think it's absolutely critical, whether it was by accident or on purpose. I may never know, but I do believe that the Chinese government did not do everything to limit the spread of coronavirus beyond their border. I too lost loved ones, my aunt, friends, and
yep.
But we'll never get them back. And but in recognition of the economic damage that China has caused, they should be held accountable.
Thank you, Mr. Pettis. I yield back.
Thank you very much, Mr. Jordan. We now recognize Ms. Maloney.
Thank you so much, Mr. Chairman. Can you hear me? Yeah. Thank you so much for holding this hearing. It's critically important to see how our first responders, our essential workers, do not even have the protective gear that they need to protect themselves. I think it's a national scandal that they are going to work and in many cases becoming sick because this vital protection is not there. I want to go back to the question of testing capacity in this country, and it's been a major reason why so many Americans have died from the coronavirus outbreak and why this crisis is still not under control today. I know that in New York, first responders, those on the front line, you were not able to be tested until you had a temperature, you were coughing and ready to be admitted to a hospital. So last week, the bipartisan experts that appeared before your committee agreed that testing needs to be scaled up quickly. They said the lack of testing was, and I quote, the fundamental failure that forced our country to shut down, end quote. And they warned that we cannot reopen safely without comprehensive testing in place to know who's sick and who's not. So testing is especially important for our frontline essential workers that are testifying today. So I'd like to ask Ms. Harden from the nurses, you're on the front line of this work. You work in a unit for patients suspected of having a coronavirus, and I understand these patients may be waiting to take a test or may be waiting for results to come back from a test. So my question is, how would the availability of more tests and faster tests impact your safety and that of your colleagues in the nursing profession? Ms. Harden.
Hi, thank you for your question. Number one of the reasons why I'm afraid to go around my family and one of the reasons that I sent my daughter away is because I don't know if I'm a carrier. It's possible to have COVID-19 and not have any symptoms. And so because I don't know and because we can't get tested unless we actually have symptoms, it's safer to stay away from everyone just to decrease the risk of passing it on to someone that I love. If we were able to be tested, if we could get the test back faster, then maybe some of the things that make life really hard right now will go away. I didn't recognize how much not being able to see my family affected me until we started talking about this. And I realized that it makes every day a little bit harder, knowing that at the end of the day, I can't go and see my family. So that if we could get tested, if there were testing available, if we could test our patients faster, if we knew quicker whether they had the virus or not, then maybe we could have some kind of normal life.
It's not just normal life. I'd say it's life and death. In New York, it's been reported that up to 250 medical personnel have been out sick. Some have died, and they can't get testing even when they think they're sick because they're dealing and helping COVID people all day. I want to ask Dr. Ramey, have you worked directly with coronavirus patients, and have you heard from medical professionals around the country who are struggling to get the supplies to protect themselves? So, Dr. Ramey, do you believe that hospitals, nursing homes, and other healthcare providers have the testing supplies that they need? Dr. Ramey.
Thank you, Congresswoman Maloney.
Because I got a lot of questions.
No, they do not.
Is the testing we have so far reliable and accurate enough to catch every positive case?
No, it is not.
And how would rapid, widely available testing help keep medical professionals and hospital workers safe?
It would be transformative. If I could test every person when they walk through my emergency department and get a quick result within 15 minutes that tells me whether they have COVID or not, I could separate out the patients with COVID from those that don't and protect them from each other. I could also protect my frontline healthcare workers. We could also, out in the community, make sure that people who are sick are isolating and not infecting others, that we don't see the curve start to go up again and overwhelm our hospitals again.
Well, I think it's a national scandal that we don't have the testing. And if the federal executive branch won't go out and do the Defense Production Act to get the PPE we need, I think that power should be given to our governors to prepare it and demand it. We're at war. We should have the Defense Production Act getting us the testing we need and the PPE we need. Now, Mr. Colts, I have a question for you. I was very struck that you go to work every day. You don't know when someone stops on your bus whether or not they have COVID. If they cough, you don't know. And would you feel safer if you knew that the people in your community had access to reliable testing, so they would know whether or not they should be quarantined? Mr. Colts.
I would actually love that if they would actually to have the same type of testing that we actually have as drivers. We have the rapid test that we can actually get where we can get ours in 15 minutes. So if that's something that can be provided to everyone across the world, across this country, that would be the most amazing thing that can possibly happen, because we can actually get, like they say, some sort of shutdown and some sort of curve where it can kind of slope down instead of just keep constantly rising up. So yes, I would love that.
Well, I want to thank all the responders, the heroes and heroines, especially Diane Wilson from the district I represent, and thank her for what she does every day with the NYFD to save lives. People are deeply grateful. Thank you, Mr. Chairman, for this. These are courageous panelists. We need to do more to protect them. At the very least, we should get their testing and their PPE to protect themselves as they protect us and risk their lives, such as Little Butterfly did, without any protective equipment. This is a scandal.
Thank you very much, Ms. Maloney. We now recognize Mr. Lukemeyer.
Thank you, Mr. Chairman, and Ranking Member Scalise. Thank you, and also to all the members of the panel today. The Select Committee is brought in. We appreciate your comments today on the effects of the early shortages and continuing shortages and risks that you incur with regards to PPE. I know in my state, our governor has said we have adequate amounts of PPE. Not that we have a lot to spare, but we are okay. And we're glad for that. And in fact, are making a lot in our own state. Since the coronavirus outbreak began, medical professionals, first responders, and other essential workers have worked tirelessly on the front lines. Truck drivers are making their way across the country to ensure grocery stores continue to receive supplies, and grocery store workers are ensuring the shelves are stocked so families have food on the table. Custodians, factory workers, farmers, the list goes on for the countless individuals risking their health as we continue to fight this invisible enemy. And many of you are on the panel today, and thank you so much for your service. But as states are in the early stages of reopening, those workers also will play a significant role in getting our economy back on our feet. And again, thank you for being here today. It was interesting. We're trying to get everything reopened now, and I know that Dr. Rainey made a statement a minute ago about data and science, and I just kind of put together some information here just in the last couple of days with regards to reopening. It seems across the board, even all different media outlets, and some of them that are not necessarily on the conservative side, have started to run stories about it's time to reopen. It's time to reopen. And again, just within the last couple of days, I saw a doctor on there who talked about the deaths of despair. People are dying. And he said we'll run around 75,000 people are dying or will die with other things other than COVID, and the result of COVID being focused on at the expense of them with regards to suicides, heart attacks, overdoses of drugs, homicides. He said that there's 90% are not getting cancer screenings any longer. And I know last week or a week before we had another meeting, Congressman Green made a comment there's probably going to be over 30,000 people die because of the lack of screening and the lack of treatment that they're not getting. 600 doctors have just recently signed on to a petition that says they need to go back to work. Over 30 people died in one particular area where they didn't get heart surgeries. Suicide rate the highest since the Great Depression. These are statements that they're making on TV. Not I'm pulling them right off the TV screen. Drug abuse, alcoholism, child abuse, domestic abuse, all up. And it's kind of interesting because we're letting felons out at the same time we're putting seniors in nursing homes where they're more likely in a high-risk category to be infected. Last week we were in D.C. trying to pass a bill that would make it more easy to vote. And the reason is, and we're voting by mail, and the reason is that you're going to not have to stand in line anymore to vote. Yet everybody stands in line to go to the grocery store, Walmart, the liquor store, even to get tested for coronavirus. It's amazing to see this. And I know, Mr. Pettis, you've experienced this from New Orleans being a hotspot and now starting to reopen and see how people are responding and how the businesses are responding. Can you give me kind of an overview of how you think the reopening is going and what else needs to be done to get this done?
Well, it's going slowly. I will tell you the anxiety level is being experienced by everyone. And I used the analogy earlier that we're 4 fathoms down and gasping for air because a few times a week, that's how I feel. I wake up in the middle of the night, and it's surprising that the number of team members have felt the same. It's kind of a joke with us because they all feel the same way. They're just so anxious as they get past. Our community seems to be doing very, very well. Our mayor's been touting our success. Governor's touted our success. And so we're moving in the right direction. But it's time to keep moving forward with regard to the economy because that is the next wave. And that is the curve that we're worried about because their anxiety level. And we think that, the amount of money that we have for PPP is going to help us. And it is. We're very, very grateful for everything. But that's going to run out. And like I said, we're going to be laying people off by the hundreds. And 85,000 people in New Orleans in the hospitality industry, a community that's reliant on tourism. It's not going to be successful. And so it is is anxiety.
I know that you've done a great job in detailing there a minute ago all the things you're doing to protect the workers and customers of your restaurants. That was a very impressive list of things you were doing. And I know that one of the solutions that we're trying to get the economy up and going is perhaps discussing a payroll tax cut. How important would that be to your employees to get a 7.5% raise? I know a while ago one of the other members of the committee made a comment about how important it would be to get a pay raise. So that would be something I think would be very beneficial. Would that be helpful to your employees? And
it would be absolutely to us, yes, but we try to look through the eyes of our coworkers as well. Ours is an industry that people don't grow up thinking I'm going to work in the restaurant industry. It's an easy entry industry, and we take people where they live and teach them a profession and how to be a cook or a waiter and hopefully make a good living. Any raise would be greatly appreciated by them, I'm certain.
One of the
Thank
key.
you very much, Mr. Pettis. Mr. Pettis, thank you. Mr. Lukemeyer.
Thank you, Mr. Chairman.
Thank you. Your time has expired. We now recognize Ms. Velasquez.
Thank you, Mr. Chairman and Ranking Member, for holding this important forum. So today we are hearing from heroes of this crisis, and we have heard the moving stories of our essential workers. And let me use this opportunity to say to Mr. Colson, Ms. Shepherd, my heart goes out to you. But saying thank you is not enough. And that is why I support the HEROES Act, and that provides $200 billion for the HEROES Fund established by this act. And I hope that it is great to say thank you, but it will be much more important that we encourage the Senate to take on CARES 2 that provides the type of resources that we need. Dr. Rani, last week we heard testimony that reopening too early without adequate testing might do more harm to small businesses and the economy. And one of the answers that was provided is that in order to get consumers through their doors, they need to have confidence. And they have to have confidence that when they walk into a restaurant, that we have taken all the steps and precautions so that people are not contaminated, that people are not getting the coronavirus. So what risk do we run by reopening too soon without proper actions?
So there are two risks. The first risk is that we can say that we're reopened, but that we won't see the economy rebound. We actually saw decreases in airline flights, in hospital visits, in restaurant visits, long before states made the decisions to shut things down because people were nervous. People are not coming to my hospital and to my ER, not because my ER is not safe, but because they perceive it as not being safe. And so unless we do this in a way that reassures people, they're not going to show up. The second risk is, of course, that we're going to face another wave of infection. If we get back to the situation like occurred in Albany, Georgia, or like occurred in my own home state of Rhode Island, where we had an early case that we didn't identify, and then the virus started to spread among our community, we know that this spreads exponentially, and we could face ourselves being right back in the same situation we were in March.
Thank you. Dr. Akers, you saw firsthand how Albany, Georgia, unexpectedly became a hotspot for coronavirus. Do you have any concerns that similar outbreaks could happen in your community or across the country if states reopen without a clear plan to stop virus transmission?
Yes, I think the issues involved with reopening are obviously very complex and very nuanced. I know we're all very worried about the livelihoods of people who have lost their jobs. And I think a gradual stepwise plan based on decreasing transmission within the community is obviously a very prudent way to go forward. I think in our town, what we have taken is the guidance that's been provided on a federal and state level and done what's worked for us in the community. And slowly done things in a stepwise fashion. And I think our case is a great example that spread can occur anywhere. We don't unfortunately control where people move or how they travel, so appropriate infection control prevention guidelines will be very important.
Thank you. And Ms. Harding, how would another spike in cases impact the risk that you and your colleagues face?
Currently, the healthcare system is starting to level out. We're seeing about at least not as many ICU patients, but we were completely overwhelmed. We didn't have enough ICU nurses to take care of the patients that we were seeing. These patients have been sicker than patients we've seen, and we currently don't even have a way to treat them. So we would be even more overwhelmed. And again, we don't have enough nurses currently to take care of the patients that we have now. So if we see another spike, then we definitely wouldn't have enough nurses to take care of those patients. This increases our risk of getting sick ourselves. It increases our risk of taking it home to our families. It increased the length of time that we have to actually be away from our families. This could be really detrimental to us as our mental health as well. Just, dealing with the issue, taking care of patients that you can't adequately take care of. And again, not even being able to go home and cry on the shoulder of your loved one after a especially hard day is difficult. And we would hope not to put ourselves 2 steps back from where we are currently.
Thank you.
Thank you very much, Ms. Harden, and thank you, Ms. Velasquez. We now recognize Ms. Borlowski.
Thank you, Mr. Chairman. I first want to add my condolences to Ms. Shepard and Mr. Colts and to all the frontline workers. Just want to honor your sacrifice for what you're doing. And I want to say to all the frontline workers around the country, thank you so much. We are a grateful nation. We are so thankful for the sacrifice, for keeping us safe, for healing the sick and manufacturing and delivering supplies, and for the folks that are feeding the country and serving those in need. I just want to talk for a second about what's going on in my district in Northern Indiana. I've been so inspired to see hardworking Hoosiers pitching in for our community. People volunteering at local food banks and Meals on Wheels, and manufacturers donating their supply of masks and other PPE to local hospitals. Some even retooled their production to respond to the crisis. Chemcrest, a chemical packaging company in Elkhart, Indiana, and the Kingsbury facility for Acid Products Prairie Packaging Company started producing hand sanitizer. GDC, an auto parts company in Goshen, and World Cell Extrusion, thermoplastic foam manufacturer in Elkhart, both retooled to make face shields. And Top Stitch, a commercial sewing company in Elkhart, started making medical gowns and surgical face masks. The list goes on and on. Hoosiers have been incredible. Small and big business have answered the call and started to ramp up production of PPE. Obviously, a key question as states began to reopen was how would businesses get PPE products that are now in high demand? I can't say enough about our Indiana Governor, Eric Holcomb. Pioneered a first of its kind Indiana small business PPE marketplace where eligible small businesses could apply for bundles of face masks, face shields, hand sanitizer free of charge. This removes a potential barrier for employers trying to open responsibly. It gives employees safety and peace of mind. The marketplace fulfilled 10,000 orders in the first week alone. I can't tell you how proud I am of the leadership and ingenuity of the Hoosier state that we've shown through this crisis. One clear lesson of this pandemic, I think, is the importance of adequate domestically produced supply of PPE. We can do this by leveraging robust public-private partnerships and through legislation like the bipartisan Medical Supplies for Pandemics Act, which I introduced with my friend Debbie Dingle from Michigan. The bill would create incentives for domestic production of medical supplies, establish domestic reserves of PPE and diagnostic tests, and better manage the supply chain at the Strategic National Stockpile for the next crisis. It's so important I think, to focus on domestic manufacturing quite simply because we can't trust China. A recent report from the Department of Homeland Security concluded that China intentionally concealed the severity of this virus so it could hoard PPE by blocking exports and by buying it up through its state-owned enterprises. There are plenty of media reports out there to confirm this. The New York Times reported in mid-March that factories in China were not authorized to export masks, and while all of them bought up much of the rest of the world's supply, even in February, Chinese entrepreneurs and aid groups visited pharmacies in affluent countries and emerging markets, buying masks in bulk to send to China. The Sydney Morning Herald similarly reported that the Greenland Group, a China-backed property giant, instructed its employees worldwide, even accountants, receptionists, and their HR team, to stop what they were doing and go buy bulk supplies of medical supplies all over, as many as they could in January and February. In the meantime, hospitals in my districts and all over the country were faced with skyrocketing prices for PPE that can't solely be attributed to price gouging. It's becoming clear that China has manipulated the basic laws of supply and demand by hoarding supplies and downplaying the true structure and danger of this virus, allowing it to spread even farther and wider. I keep hearing this notion that the notion that China accountability is nothing more than a distraction. Well, it's not a distraction to me, but that couldn't be further from the truth. Getting to the bottom of China's role in these PPE shortages is at the very core of ensuring adequate supplies to protect frontline workers. Last week, I posed the question on this committee, what's going to differentiate this subcommittee from the dozens of other oversight bodies aside from blatant, blind partisanship? We're on the second briefing now. We've heard from 10 Democratic witnesses and 1 Republican witness. I hope we can do better. I hope we can put a premium on substantive work, on holding China accountable. The American people deserve it. All these frontline workers here today and around the country deserve it, and I yield back.
We now recognize Mr. Foster.
Well, thank you to all our panelists for joining us this briefing today. We're honored to have several frontline essential workers join us today to give their firsthand account. But of course, it is not just the workers themselves who face risk of infection, but also their families. Our increasing knowledge of the prevalence of asymptomatic carriers of COVID-19 and our continuing lack of testing availability means that frontline workers who never experience symptoms can still spread the virus to their coworkers, their family members in their household, and to their community. This is not an abstract discussion for me. In our office, my chief of staff has 2 parents, both nurses, who have been working in a hard-hit and understaffed hospital. And this week, they both tested positive. It is interesting what we can learn from the experience of other countries. Like all countries, Canada was lied to by China, and yet because Canada's leadership listened to its national security advice, listened to its scientific advice instead of mocking it, Canada has a much smaller per capita death rate than the United States. Canada also has a very different attitude toward the science-based safety of essential workers. In Canada, essential workers are given the best available scientific evidence on how to protect themselves, and Canada's CDC is not being muzzled by the executive as it is in the United States. Most importantly, in Canada, any nurse, any essential medical worker has the right to walk off their job if they believe that they are being asked to work in unsafe circumstances. So, as a result, as of May 11th, the number of nurses who have died of COVID in the United States was 91, and the number of nurses who had died in Canada was zero. So the leadership that listens to science, that exhibits competent planning, and has a real commitment to worker safety matters. And this commitment to essential worker safety did not come at a cost to the quality of Canada's healthcare. As I mentioned, Canada's overall casualty rate from COVID as a fraction of its population is far smaller than the United States. So when you keep essential workers safe, the health of the whole population improves. Meanwhile, here in the US, essential workers are kept in the dark about the best scientific practices to keep them safe. Essential equipment is often not provided, and some are forced to take desperate precautions to help protect their families, including attempting to self-quarantine within their own homes, something that epidemiologists will tell you is difficult to impossible. So I'll start my questions by giving the floor to my fellow Illinoisan and ask Ms. Harden if she could respond first, and then open it up to anyone else who'd like to respond. Ms. Harden, could you tell us what steps you and your coworkers take to try to minimize the spread of COVID-19 within your household? And how does your role as a nurse during the coronavirus crisis, how has it impacted your family?
Thank you for the question. It's actually a conversation that we have at the nurses station every single day. Most of us are staying somewhere other than with our family members. I said earlier that I sent my daughter to stay with my mom so that I don't inadvertently give her coronavirus. We have dealt with a shortage of supplies at the hospital. A lot of us have personally went online and brought our own respirator masks because they weren't provided for us, trying to keep ourselves and our families and patients safe. Many of us get undressed, stuff in plastic bags, and leave them there for days because we are afraid of taking it in through our clothing and putting it in our washing machines and somehow infecting our families. We're not sure if that's possible, but we're very afraid that it is. We try to change at work and shower as soon as we walk through the door. And we try to stay as far away from everyone as possible. It's really difficult to self-distance at work because, of course, we work in close corners and we rely on each other to be able to do our jobs. We have to be very close to each other at all times at work, helping with patients and things like that. And so we kind of look at each other and say, you know, it's probably inevitable. We'll probably contract this disease. And so, again, the best thing we could do is not see our families, which has been difficult for all of us. I have one coworker whose parents have told her, I don't care. We'll get sick, but we miss you and we want you to come and see us. I had a friend ask me, do you consider quitting your job? My daughter thinks I should quit. Of course, I love being a nurse, and that's not something that I would ever do. But so there's lots of things that we've been trying to do. We try to talk to each other to keep our morale up so that we don't end up depressed about the situation.
Well, thank you.
Thank you very much, Mr. Hodney.
Yes, your story is being replicated by essential workers all over the country, and my heart goes out to you. Yield back.
Thank you very much, Mr. Foster. We now recognize Mr. Green.
Thank you, Chairman Clyburn and Ranking Member Scalise, and thank you all to the witnesses for being here today. Before I address the PPE shortage that our witnesses have spoken to today, I want to remind the committee that in medicine, knowledge changes daily, and over time, it impacts medical decision-making. For example, years ago in my emergency medicine residency, we were taught 6 days of an opiate will not cause an addiction. Yet today, as all the medical professionals here know, addiction can happen as soon as 3 days in some people. Should we castigate the doctors who operated under the old understanding for trying to treat pain, but actually they caused addiction? No, they were operating under the best information they had at the time. Through this brand new, novel coronavirus pandemic, our knowledge has changed almost daily. Great scientists and doctors allowed us to learn more about this virus in real time. And as we look back, we must remember to do so in light of the information we had at the time. When the coronavirus first started spreading, not only did China hide its severity and spread from the world, they covertly hoarded PPE. According to the Washington Post, not a conservative bastion, by the way, the Washington Post stated U.S. manufacturers exported roughly $31 million of PPE in the first 2 months of 2020, much of it to China. Let me say that again. In January and February, we were shipping our PPE to China. For context, it was an increase of 1,000% compared to the year prior. And while the United States provided this aid to China at a crucial time, they didn't blink an eye when the coronavirus reached American shores. At the height of our fight against the coronavirus on April the 10th, the Chinese Communist Party imposed strict export restrictions on PPE, stranding American companies' U.S.-bound supplies. American executives have testified that the Chinese government coerced them into not exporting their PPE. Italy donated PPE to China, and the Communist Party had the audacity to charge Italy to get it back. While China has claimed it was ramping up production, the truth is, at the same time, its exports drastically decreased, causing a PPE shortage around the world, a world that by this time was fighting Xi's virus. The Trump administration has worked tirelessly to get PPE to our states and hospitals. In collaboration with partners in the private sector, the administration ramped up production every day. They secured donations for needed equipment. They utilized the Defense Production Act to quickly mobilize PPE. And FEMA has launched Project Airbridge, an unprecedented operation to expedite critical supplies to our frontline workers. For instance, the week of April the 20th, Project Airbridge worked with FedEx and DuPont to ship 450,000 Tyvek protective suits from Vietnam to Texas. And recently, on May the 8th, they sent another shipment to New York that included nearly 1 million pairs of gloves, 194,000 gowns, and 200,000 masks. The federal government's response led even Governor Cuomo to say in an interview that President Trump, quote, has delivered for New York, he has, end quote. The fact is, unprecedented amounts of PPE have been sent to every state and territory. As of May the 15th, this included 46.4 million N95 masks, 8.9 million eye and face shields, 422 million surgical and procedural masks, 1.1 billion gloves, and 207 million gowns. Nevertheless, the fact remains, if we had known about this virus sooner, we would have had more time to act. According to one analysis, as I mentioned last week, at least 56,000 more Americans would be alive had China spoken up about the virus just 1 week sooner, and more than 96% of the deaths may have been avoided had they spoken up 3 weeks sooner. If this committee is to have any credibility, we must start looking into how this virus actually turned into a pandemic and caught the world unprepared. China lied and people died. China has lied about the number of infected patients and death in their own nation. After the communist government kicked out American journalists, they delayed for weeks, if not months, reporting of the virus. And Chinese foreign ministry officials made the absurd claim that brave American soldiers are responsible for Xi's virus. Many Americans have lost a loved one to COVID, including some here today, and my heart goes out to you all. And for your loved ones, we must hold China accountable. Mr. Chairman, this is the committee to find these answers. We're supposed to look into it with a vigorous oversight, every aspect of this crisis. And if that is the case, then I ask, is there some reason why the majority refuses to hold hearings on China? Thank you, and I yield.
Thank you very much, Mr. Green. The chair now recognizes Mr. Raskin.
Mr. Chairman, thank you very much, and thank you for convening this panel of heroes. And I want to tell them that we have named after you the legislation that we passed on Friday, which honors you not just with words, but with real resources, putting resources into the front lines so you can have the equipment that you need to do your job safely. You may be heroes, but that doesn't give your government the right to treat you as martyrs and to turn you into martyrs. So thank you for what you are doing every single day. Mr. Chairman, we created the Constitution and the government of the United States to promote the general welfare and to provide for the common defense. But the national government has not been successfully protecting or defending the people against this killer virus. We have instead lost more than 95,000 Americans. That is more Americans than we lost in the Vietnam War, in the Iraq War, in the Afghan War put together in a period of less than 4 months. We have seen 36 million Americans thrown out of work because of the mismanagement of the government, and we have nearly 1.5 million Americans who have been infected with the virus. The national government should be coordinating the procurement and logistics of all the health equipment we're talking about today. The masks and the gowns, the ventilators, the testing kits, everything, all of it, the federal government should be coordinating it, but it's not. It's pitted the states against each other in a brutal, ruthless competition for resources, essentially erasing the federal government's constitutional role and going back to the Articles of Confederation when it was every state for itself. Mr. Chairman, President Trump, while promising that the virus would magically disappear, and while praising the government of China and the leader of the Central Committee of the Communist Party of China 37 different times in January, February, March, and April, refused to take responsibility for providing the necessary health equipment to the states, the counties, the cities, the hospitals, and the people. Here's what President Trump said: the federal government is not supposed to be out there buying vast amounts of items and then shipping. You know, we're not a shipping clerk. So states, counties, and cities have been left to their own devices, and the federal government has basically been acting like a spectator or a heckler. Dr. Rani, can you tell us about your work to help hospitals around America secure personal protective equipment for the nurses and the doctors and the health officers? Why was your project necessary in the first place?
Thank you, Congressman. Our project was necessary in the first place because, as you and others have outlined, there simply was no PPE to be able to be purchased by hospitals in the early days of this epidemic. There were a few different things that happened. The first is that despite knowing that this was coming, we had not ramped up American manufacturing in advance. So there were tremendously limited supplies in the United States. There had not yet been the federal declaration allowing us to use NIOSH-approved N95s as well as FDA-approved N95s. Additionally, as others, including you, have outlined, there was limited ability to import protective equipment for a wide variety of reasons. Much of our PPE is manufactured overseas, unfortunately. There were no planes coming out of China. We couldn't get it. A lot of what we did get was counterfeit. And then on top of that, we had all of these hospitals and health systems competing with each other. Prices of PPE, normally it would cost about $1 to suit up a healthcare worker adequately. Instead, it was costing us between $10 and $20 to get the adequate amount of protective equipment that a healthcare worker or other frontline essential worker needed to safely be face-to-face with a patient with COVID-19. On top of that, as we competed with each other, not only did we drive prices up, but we saw the minimum order number go up. And most hospitals can't pay cash on hand, which is what a lot of these suppliers were asking for.
And you saw a lot of price gouging too, right?
We saw a ton of price gouging. We saw scammers and counterfeiters. This is stuff.
Well, Doctor, let me ask you this. The administration disbanded the pandemic response working group in the National Security Council. The administration ignored warnings of its own doctors and even people in the White House who were screaming about what was coming. Do you think the federal government should have taken responsibility for the supply chain and for coordinating procurement and logistics?
Yes, sir. Very early on, I, Ashish Shah, and Val Griffith wrote a piece that was published in the New England Journal of Medicine calling for federal coordination of the supply chain of PPE.
Okay,
and I will say Indiana's work is great, and it should be done nationally. What Indiana has done
to Zenobia Shepard, who is a fellow Marylander. We are so sorry for your terrible loss, but I want to ask you this. Your daughter gave the final sacrifice for her community and for the American people. What do you think the government owes to us? Do you think that the government should take responsibility for providing logistical support to the states, the cities, and the hospitals?
Absolutely.
And I yield back, Mr. Chairman.
I recognize Mr. Kim.
Thank you so much, Chairman, and thank you to everyone, all the witnesses, for participating today and sharing your story with the American people. In preparation for this hearing, I've been talking with a lot of essential workers in my own district, and I've been hearing from them a lot of the same stories of the difficulties that they've had with personal protective equipment, with regards to testing and other challenges that you've raised. And I think a phrase that Mr. Colts said earlier in his remarks has kind of lingered with me here, which is, he called himself a person of service. And I really think that really hits at the heart of what people are doing when essential workers are continuing to go to work, knowing full well that they're putting their lives at risk. The stories that sort of cut between a lot of the different threads of your work, talking about the families and the suffering that you've had with wondering whether or not you are infected. I remember Ms. Hardin saying, quote, "I don't know if I'm a carrier." And your concerns about that. As a father of two baby boys, I share those concerns, and I can only imagine the anxiety that you face every single night when you came home. I wanted to talk through some of the next steps. I think one important part of this committee is thinking about where things are right now and what we can do to help you get through just the day-to-days. But I also think it's important for us to have that strategic thinking looking forward of what are some of the next big challenges that we face. And Dr. Rani, you really walked through a lot of the challenges that we are facing with personal protective equipment. I'm hearing from Dr. Fauci and other experts that a second wave is inevitable, that we should expect something of the sort later this year. This worries me about what our level of preparedness is for that type of problem. We want to do everything we can to make sure that this is not at the same or even near the level of challenges that we've faced already. So I wanted to ask you, from your perspective, are we prepared for that second wave? And if not, what are some steps that we should be taking right now to make sure that we are?
Thank you, Representative. I do not think that we are currently prepared for a second wave. We still lack adequate protective equipment in most hospitals across the country. I know Dr. Green is also an emergency physician. I know during his residency, we would never have reused N95s for an entire shift. We never would have reused surgical masks in between patients, and that's what we're doing now. We also still lack adequate science. I'm so thankful for the funding that you all have given to NIH and CDC, but it's not enough, and we need more, not just for COVID, but for all those other medical problems that we're facing as well, which have shifted as we've treated for coronavirus. We also lack adequate public health messaging. We need consistency in our messaging to the public so that they can believe us. We need to give them accurate data, and we need to give them straightforward answers. We also need to be clear about when and why our answers change and how those depend on science. But most of all, we need adequate protective equipment and adequate testing for frontline workers, not just in healthcare, not just in nursing homes and SNFs and hospitals, but also all of you who have testified today. Everyone who's out there facing the public needs to be safe. And to do that, they need to be tested, and they need masks and gowns and gloves and sanitizer.
When you're talking about the personal protective equipment challenges that we're having right now, a lot of what I'm hearing makes it sound like whatever is coming in right now is just going straight out to use, that we're not at a level right now where we're able to rebuild our stockpiles. Is that correct from your experience with both your hospital you work with as well as others that you're in touch with? Or is anyone able to start rebuilding that stockpile and preparing for the second wave or preparing for spikes going forward as we start to reopen?
So I certainly can't speak to every hospital in the country, but I can say that based on my experience at Get Us PPE on a national level, we still are millions and millions and millions of pieces of PPE short from what hospitals need currently, much less what they need in order to build the normal stockpiles that we all keep in order to face pandemic situations.
There's a lot of concern now, certainly as we're starting to reopen. We know that businesses, small businesses, other businesses are going to start to seek testing as well as personal protective equipment for their employees, that the more general public is trying to get more access to this, as they should, as we want to make sure that people have the masks and other equipment that they need. But certainly those types of increases are going to put further strain on the limited number of vendors and the abilities for hospitals and other essential workers to get the personal protective equipment. So I just continue to urge us to move forward, continue to, as a country, strategically calculate what we need, utilize the maximum of the Defense Production Act to be able to get there and make sure we're prepared for that second wave and any other spikes. So thank you again to everybody for joining with us today, and I yield back, Chairman.
Thank you. Thank you very much, Mr. Kim. Before closing this briefing, I would like to yield to the ranking member for any closing remarks he might want to make. Ranking Member Scalise.
Well, thanks again, Mr. Chairman, and to all of our witnesses and all of our frontline heroes. I think, you heard a lot of conversation here about how we got here, where we are. And the biggest issue is what can we all be doing together to help keep people safe, to start reopening our economy safely. And look, when we talk about reopening, nobody is suggesting that there should be a trade-off between your physical health and your economic health. We can do both. We have to do both. Luckily, there are a lot of templates out there, places who have started to do it the right way. I think Mr. Luckemeyer's point and Mr. Green's point are very important about the physical and mental cost to having a shut-in. And the idea that some people might suggest that we should all stay home until there's a vaccine, and we know this could come back again, but we also know that we just can't keep things shut down, and there is a human cost to shutting in. The suicides that are up. I've seen it in my own home parish where you see people that are not going to get their regular checkups, not if they have chest pains, they're not going to the doctor like they normally would, where they can catch things early, and they are dying of heart attacks. And some of the witnesses even talked about that. And so there is another cost to this too, which we need to be cognizant of all of the human cost, both on shutting in and safely reopening, and focus on helping people get back out safely. Focus on how to bring more of that manufacturing of vital things like PPE into our country. And President Trump is doing this. He has absolutely been using the Defense Production Act, and we'll keep doing it. If we can focus together as a committee on what China did, how they hid it from the world, why the World Health Organization has serious issues. Dr. Tedros ought to be here before this committee answering some of those serious questions because they've lost their credibility. And I think the world needs that kind of organization to have credibility, and they don't. Why were they the mouthpiece covering up for China instead of helping the world learn how to save more lives? And so as we work to bring more of those things back to America, surely it takes time, but we're already seeing some success, and we need to see more success. We all need to work together to do that. And I appreciate the chairman focusing on this. Hopefully we can have hearings on some of these things too, because China needs to be held accountable. We need to make sure this doesn't happen again. They're opening up their wet markets again. The places where these kind of diseases, not just COVID, but other diseases have started, they're going back to those old ways again in China. We should all be up in arms and working to stop that from happening as well. And I yield back again. Thanks, Mr. Chairman.
Thank you very much, Mr. Scalise. As we conclude this briefing, I want to take a moment to address concerns that have been raised over a remark I made about what our aim should be in addressing this pandemic. I said that this crisis presented an opportunity to restructure things to fit our vision. That vision of mine is a country that provides for all of its citizens liberty and justice for all. That is the way we conclude our Pledge of Allegiance, with liberty and justice for all. And that's my vision for this great country. Doctors Rani and Akers have talked about the need to restructure our healthcare system in order to make it accessible and available for all. When we rely on healthcare workers to save our lives, but don't provide them the protective equipment that they need to save theirs, that is failing, and that needs to be restructured. When we rely on farm workers and grocery store clerks to ensure that we can buy food for our families, but they don't get paid enough to ensure that they can buy food for their families, that is a failing that must be restructured. When we rely on transit workers to help us make it home safely, but don't provide the safeguards to help them make it home safely, that is a failing that needs to be restructured. Restructuring these failings must start with the mission of this Select Committee, ensuring that the funds that we have appropriated are spent effectively, efficiently, and equitably. For the sake of the workers who have heard from today, and in honor of the memories of those who aren't here, I hope that we can work on a bipartisan basis to improve the structure affecting the lives of those American heroes. I thank all of our panelists for being here. I thank all of our members for participating, and thank you, and God bless America.